Welcome to San Luis Podiatry Group. Happy to present a DVD presentation on orthotic dispensing. The custom orthotic, which is the medical prescription device that you're receiving today, is a very important part of your overall lower extremity care. The idea of a custom orthotic is to control abnormal foot motion, called pronation, as well as reduce pressure in painful areas of the foot. The orthotic is a device that needs to be used as directed by your physician in all shoes over the period of time that you're being treated for your specific foot problem. As you remember, when you were casted, this is the plaster mold of your foot that was taken in a non-weight-bearing setting. This negative or neutral suspension cast is actually then sent to the lab that as they scan the image of your foot into their computer-aided system, they're able to generate a positive mold of your foot. This positive mold has the specific corrections that's designed for you based on your specific foot problem. Materials are actually heated up over this positive mold and then honed down to the actual specific dimensions of the custom orthotic. This custom orthotic generally is made out of a semi-rigid material. This is a thermoplastic material that is in fact heat molded over the positive cast itself. Plastics, although they do look very hard and uncomfortable, ultimately because they maintain the shape of your foot, should be quite comfortable after appropriate break-in period of time. The main materials of these custom orthotics are, as discussed, semi-rigid plastics as well as carbon graphite materials. These materials generally help support the foot and overall control abnormal foot motion. The material itself affects very much the ability to transfer an orthotic from shoe to shoe. This shell orthotic tends to be one of the easier orthotics to transfer from women's as well as men's dress casual as well as athletic shoes. Additional materials can be added on to the orthotic based off of the specific foot problems encountered. This top cover material, which is made out of a foam material, as well as additional modifications on the orthotic itself, do affect shoe fit, but also help treat specific foot pathologies. Important features to look at when you're choosing shoes for the use of your orthotics is generally a shoe with a removable innersole. By being able to remove this innersole that comes with the shoe, it does allow you to appropriately adjust the fit of your orthotic within your select shoe. A shelled orthotic like this generally works quite well just placed in over the insole of the shoe. If needed, however, the insole can be removed entirely, as shown, and the orthotic can actually fit just into the shoe alone. Most lasting of the shoe itself is made out of fabric materials, so usually you don't need anything against your sock wear within the shoe. This women's dress casual shoe also has removable innersole. These are nice design features to look at in any dress casual shoe. Women oftentimes, more so than men, have fit-related difficulties related to the styling and design of shoes. This certainly can be a source of frustration at times with regards to use of an orthotic. But the ability to increase shoe room with the removable innersole and the use of an orthotic is a very nice design feature in general to look at. You can refer to your ProLab orthotic break-in instruction pamphlet that we'll send you out with. ProLab does have a website of which we'll post for you. They do have additional information on your orthotics. In the future, if your orthotic is very comfortable, you may actually want to order a secondary pair of orthotics or a specific dress orthotic that will fit more appropriately into a dress shoe. The office on your behalf can check insurance coverage for additional orthotics. Most insurance companies, if they do cover the cost of additional orthotics, will do so after a year to 2 years after your original orthotics have been prescribed. If you have any questions, don't hesitate to call our office anytime, 543-7788, or check the website, sanluispodiatrygroup.com. Thanks again.